John is kind enough to come in and talk with us today. I'm passing out an evaluation form. Just keep sending them around. It's like the one we used a couple weeks ago. Okay, how's this for you? You okay? All right, so John, thanks for coming in. I met with John a little bit for about a half an hour now, so I have a head start on what's going on here. But John is very active. He and just tell us a little bit about what kind of work you used to do.
He inside worker there in the budget for the city of San Antonio, the city manager's office. Several years ago, I retired, about 20 years. You're still at it, I understand.
Okay, good. Yeah, I understand that too. Here's a couple chairs for people if you need a stool. Also, if you could tell us a little bit about kind of your hobbies and what you enjoy doing.
Well, what I enjoy doing the most is kayaking, paddling, fishing, fly fishing, and bicycling. That primarily. Used to be a competitive tennis player, don't do that anymore. Enjoy it for a long time.
And how long ago was your accident?
5 years ago.
And what happened?
I was doing push-ups actually, and apparently went over the line with it and blew out a blood vessel at the top of my head, and just sort of paralyzed me, left side all the way down. I have a great respect for the field that you all are in. I hope you persevere, and they sure did a lot for me before they were done with me. I couldn't move my tips of my fingers. Through physical therapy, I guess I'm where I am right now, which is quite a way, I think.
That's pretty neat. So the day before your stroke, your hemorrhagic stroke, what were you feeling? What were some of the things that you were thinking about or feeling?
Well, as a matter of fact, that day before that I actually had the little blowout in my head, I said to myself, this is sure a lot of pressure building up in my head. I was in the second half of 250 repetitions, and that maybe I ought to cut this down. But the next day I went on with it, blew it out. Had no particular reason for it to happen. Just did it.
So you're doing push-ups. Yeah, so one question comes up for me is, were you holding your breath when you were doing that? But that might be something you don't really remember.
It could have been.
Because during a Valsalva maneuver, some people do, increase their blood pressure. And I don't know about you, but when I do push-ups, I think I'm pretty much holding my breath.
Yeah. I think the repetitions build up, may encourage you not to breathe. Anyway.
So, tell us a little bit about what your course of therapy was like. What happened? How much were you able to move right after your stroke, your arm and your leg, and then how quickly did you start recovering?
Well, I went into Methodist Hospital, and I think the next morning I just started looking at my hand and move it, and it wouldn't move, nor would anything else. So right away they got me up and started making me try to move around. From there, the next few days, I moved into the Methodist Specialty Hospital and spent a month there with the physical therapist.
So a few days in acute and a month in specialty. Could you feel your left side at all?
Very little. And no real sensation of putting my foot down, except I could feel the pressure of it landing, but not any real feel. Which goes on today, but at much less degree.
Or did you ever lose your speech?
They said I did a little slurring.
A little slurring. Not much.
Not to any great extent.
Did you lose your ability to swallow or anything?
Somewhat. Just have a tendency to choke on things.
Still?
A little bit, yeah.
And what about, did you lose any vision or anything?
No, vision.
Not really, okay. Did you think that your face drooped on either side?
Yes, they said that it did.
Yeah.
I wasn't aware of it, they said.
And any difficulty when you turn your head fast to either side?
Sometimes my head swims a little bit when I turn, bring it forward, especially if I'm walking. It really doesn't happen when I'm stationary. Or if I, say, we'll look up at a star while I'm walking at night, bring my vision back down, I'll probably move to one side or the other.
So, what would you describe then as the area of of major concern to you? Is there anything in particular that you want us to pay attention to today?
Well, keeping my balance is and walking straight, I guess that's as simple as I can put it. I would mention too that the day that I was able to get up after that stroke and put my feet down and move, I started using my toes as claws, really just hold myself in place. That's gotten worse. Haven't really found anybody who knows any solution to that, other than cutting the tendons of my toes straight like that.
Thank you.
Okay, does anybody have any questions for John at this point? That you'd like to ask? Okay. Are you on any medications right now?
I take medication for pain that developed from the stroke and high blood pressure medication.
Okay, what are those?
And one small dose of an antidepressant is supposed to work with the pain medication.
Okay. Do you know the names of those medications?
Amitriptyline or Elavil is the Elavil is the antidepressant. Hydromorphone is the painkiller.
So those are supposed to work together, okay. And then your blood pressure medication?
Norvasc.
Norvasc. Okay, thanks. So what is a typical day like for you?
Well, I'm retired, and I have a large dog that I walk twice daily. Actually, I use a bike, and he walks.
So you bicycle holding on to this dog? Oh, you let him go and you bike behind?
We thought about doing that.
I'm trying to picture
I trained him
this.
to walk with me.
Okay.
He stays with me.
He pulls you, he doesn't pull you along.
I tried that leash thing.
Okay, so you walk,
came down then.
yeah, you walk this big dog twice a day. About how long does that take you to do?
Oh, about an hour.
So you're on a bike 2 hours a day?
And I use it for errands too. I
Mhm.
use the car. For hobbies, I kayak quite a bit from Flatbush, from the boat.
Good. You do anything else in a typical day?
Yeah, there's always a lot of paperwork to do.
Paperwork? We know about that.
So some, not much.
Okay, well, the first thing I'd like to do is there's.
Yard work, excuse me.
Yard work.
Yeah, I have quite a lot of area to maintain.
That keeps you busy, so you're a busy fella. All right, any other questions that you'd like to ask at this point? I'd like to have you just stand up, please. Okay, and then just walk down towards Tuan and walk back, just wait. Good, turn and come back. Very good, turn and have a seat. Beautiful, fantastic, thanks.
It helps if I watch exactly what I'm doing, not to look away.
Not to look away?
I'll start.
Okay, so you have to concentrate on this, okay.
Helps to watch each foot of words.
Very good. I'm gonna test some things now. I asked you some questions that make me think, well, maybe we need to, look at this area, so let me get a couple pieces of equipment, and, we'll test a couple things here. Okay, first off, I just wanna know if you can, follow this, if you can follow my, orange device here with your eyes. Little difficult when we go to this side, huh? Little ratchety is what I would call it. But other than that, doing good. You know what, I noticed that you wanna turn your head with it rather than keep your head steady, so try to keep your head steady this time. That's better. Now, keep your eyes on this and turn your head side to side. Focus on this. Is it getting blurry in either direction for you?
Seems like there's a double image.
A double image when you go which way? This
Both sides.
when you go to the
Lateral.
extremes? Okay.
The extreme.
Now go between the reflex hammer and my nose. Just with your eyes. Okay, now up and down as fast as you can. I'm sorry, I'll make them smaller. Here and here. Let's just have you turn your head side to side. Look all the way over towards John. Good. And look all the way over to your left. Any pain or anything in your neck at all? Not at
A
all.
little stiffness on this.
A little stiffness on this side when you turn to the left?
Like it's not gonna quite go.
Looks like it's not gonna quite go. Okay. So, all right, good. So, with your vision, you were saying that you're having some dizziness when you look suddenly to different directions. That's why I wanted to test your vision. All right. Okay, let's see if you can do this. Can you smile real big? Stick out your tongue. Okay, push your tongue into my fingers. Over here. And over here. Okay, good. Okay, clench your jaws down. Okay, lift up your eyebrows. Okay, lift up your cheeks. You have to smile to do that. Oh yeah. And purse your lips. I just washed my hands too. All right, so now what I'd like to do is see if you can say ah real loud. Louder? 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 So, that's pretty good. Okay. So you can call for help if you're in the middle of, fall down a gully somewhere while you're bicycling, right? Okay. Now I'm gonna feel.
You're concerned about that, aren't you?
Very concerned. Okay. I'm gonna touch your forehead with this cotton. Okay? Tell me when you feel me touch you, okay? Close your eyes. Does this feel the same as this?
Heavier on the left side.
Heavier on this side?
On left.
Your left, it's heavier over here on your left? Okay. Feel this?
Yes.
Is this the same as this?
It's more of a brushing on the lower cheek.
You feel this?
Yes.
Is this the same as this?
Same.
Is this the same as this?
Same.
Is this the same as this?
It's heavier on the left.
Is this the same as this?
One's higher than the other.
Is this the same as this in terms of feeling?
Same.
Is this the same as this in terms of feeling?
Pressure.
Feeling.
Right seems heavier. My butt.
Okay, so this seems heavier than this?
Yes.
Okay, let's try to, you feel that?
Yeah.
Does that feel the same as this?
Same.
Same, basically? So the question is it my technique, because I'm at the side, I'm trying to stay out of the way? Or is it truly a difference? So I don't think there's really any big differences. Close your, let me show you this. I'm gonna kind of push into you with this sharp end, okay? Tell me if you feel it. Does it feel sharp there? Does this feel sharp? Does it feel the same as this?
Yes.
Close your eyes. You feel this?
No.
Feel this?
It's
Does that feel the same as this?
harder lower. More pressure lower.
You feel this?
Yes.
Does it feel the same as this?
No.
Which one do you feel more?
Stay about equal.
You feel that?
Yes.
Does that feel the same as this?
No.
What's the
Feel
difference?
the point lower.
Forehead more? Feel this?
Yes.
Does this feel the same as this?
Yes.
Okay. You feel this?
Yeah.
Does this feel the same as this?
No.
Which one do you feel more?
It seems like I feel your finger on the side.
Where? Which one? So I'm thinking down here is a little decrease for pinprick. Pinprick might be a little more discriminative than the light touch. Those of you that, when you were practicing, remember, some of you couldn't even feel the cotton swab, okay? All right, okay, thanks. So I want you to next stick out your tongue again, all the way, as far as you can. Okay? And go to your right with your tongue, outside your mouth,
Your
like,
right.
watch me. Okay. And swallow. Okay. Say out real loud, I wanna look inside your mouth. Relax. Again. So I need I can't really tell, but it looks like both sides are elevating smoothly, but it's very loud when I ask you to go loud. What I'm looking for is equal elevation, but you're reporting to me that you're having some trouble swallowing on occasion. Okay, that could be related to your neck stiffness, or it could be related to weakness of the muscles in the back of your throat. Okay? Okay, let's see, let's look at your eyes. And we'll let you leave your glasses on, or you can take them off, either way, it doesn't matter. Just look straight ahead. Good pupillary constriction with good consensual constriction on the other side, so that looks good. Okay, so I'm seeing that you're doing pretty well in terms of all of that. My only concern so far has been kind of your ratchety movement of your eyes when you're looking that way, which we can talk more about later about some simple exercises for that. Okay. All right. Next thing I want you to try to do is, I want you to lift your arms up over your head. At the same time, both at the same time. Okay, and put them behind your back like this. Okay, good. Raise them out to the side like this. And now raise them up over your head like this. Okay, excellent. Relax. Okay, so any discomfort in your shoulders with any of those movements?
There is in this one, to some extent.
What did he
Alright.
say on that?
Pardon me?
What did he say on
Little bit of discomfort in the right one, but more so in the left. Can you point to where the discomfort is over here?
Top.
Right in the top over here? Or over here?
Oh, yeah.
Okay. And where is it over here? Diffuse? Can't really tell.
Well, I think it's more, it seems to be deeper down, lower.
Deeper down,
into it.
deeper inside the joint,
Yeah.
so to speak. Okay, lift up your arm. I'm just gonna feel for some, I'm just feeling a little bit of joint, integrity here. And I'm feeling just a little crunching inside, right at the capsule area, right inside the joint. Not much though. Any of that reproduce that discomfort? Any of those motions reproduce your discomfort? Is it right there? So possibly some just impingement on the supraspinatus, but we'll take a closer
I
look
have a
at
lot
it
of
in a
trouble
minute.
reaching, pushing, or placing that.
So we'll come back to that in a minute. On a scale of 0 to 10, what would be the discomfort in your shoulder on this side?
Well, it's only in certain movements, so, I mean, at that time, it might be 5 or less.
While you're moving.
Yeah. Well, pushing above.
Okay, good job. Okay, put your arms out like this. Now on this side, I want you to turn your palm up like this and down. Okay, go ahead and turn it up and down. Now, relax. Now turn this side up and down. Good, excellent, very nice. Okay, so that bother the shoulder again?
It's very, tight.
Can you point to where it feels tight?
Oh, it starts in here, bicep.
All right, put your arms here and take this arm and raise it up all the way up to the sky, ceiling. Good, excellent. And relax and go back. Now do the same thing over here. Raise it up as far as you can. And relax. Good job. Good job. Now we're going to do something real simple here. I want you to touch my finger and then touch your nose. Okay? Touch my finger and touch your nose. Okay, touch my finger and touch your nose. Okay, I'm going to have you do that repeatedly for 10 seconds. Okay, just keep your watch like this because I'm going to use your watch. Cheat. Ready?
If I can hold it.
If you can hold it still, if I could see it. Okay, somebody give me 10 seconds. Say go when we're on the dot. Ready? And go. Starting over. 2. Keep going as fast as you can. 3. Fast as you can. 4, 5, 6,
Stop.
7. Now the same thing on this side. Give me another 10 seconds.
Ready?
Let's start here. And I'm going to practice first. Go. This is a practice. To your nose. Who's ever timing, say go.
Go.
And go. I'm saying go this time. 3.
Stop.
Okay, so that's not the most accurate way to do it, but you still see a difference. 7 and 4 in 10 seconds.
That's very revealing. I've never had that done before.
Okay. Put your heel on the floor, and what I want you to try to do is bring your knee up to your chest like this. On this side. Good. Now same thing on this side. Excellent. Okay. Now what I'd like you to do is I'd like you to slide your leg underneath you on the right side. Beautiful. Now slide it under on this side. And keep your foot on the floor and try to do that again. Beautiful. Relax. Now can you lift your right foot up off the surface? Keeping your heel beautiful. And just tap your foot here. Okay? And lift up, way up. Good. Okay, now lift your toes up on the other side, please. Keeping your foot on the floor. Good. And tap. Let's just see how you go. Okay. And tap. Just checking his range, actively and passively. If at all possible, I can do this in a short period of time. Okay. Can you take off your shoes and socks? Do you like these shoes?
Yeah, so, not the best for me.
How long have you had these shoes?
These particular.
This pair, yeah. About a month? I wanna look inside.
Pretty sweet shoes.
Pardon me?
Pretty sweet.
Yeah, I just, I'm looking inside, and I wanna look at the wear pattern of them, but a month isn't gonna tell us much. But there's a reason why I wanted him to take off his shoes so that you could see what was happening, here. Those are nice socks too. Okay, alright, now let's try it again. Lift up your toes on this side, your ankle and toes, good, and lift up on this side. Okay, now, this is what I'd like to do. I'd like to see if you can tap this foot. Good, and how about tapping this one? Very nice, very nice. Okay, give me 10 seconds. Ready, set, tap, you're gonna tap this foot, and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23. Okay, so 22 or 23, plus or minus, we don't know, because I set these. This side, ready, set, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20.
Stop.
Okay, so not too much difference on either side, on there. But people are wondering why I'm ignoring these hammer toes. I'm not ignoring them. And this is a major problem here, isn't it? These are sources for potential skin breakdown, potential pain. Do your feet hurt at all?
No. Well, no, not really.
Not really? Do the hammer toes bother you? Does it bother you that they're clawing all the time?
Certainly constantly brought to my attention,
Does it bother you sitting here with your feet on the cold surface?
not especially.
Okay. Because I can get a towel if need be. Somebody run up front.
No, that's.
You're okay? All right. All right, so we have this guy here who is definitely, this is fixed. This is not moving anywhere. We have redness here on first met head. We have, I don't know if you guys can see this, but we have calcaneus that are kind of extreme. Explain your history in terms of why your calves are atrophied and why your calcanei are so distinct.
I had some problems with my Achilles tendon to the extent on my left one. I had that reconstructed.
So this one was reconstructed, that's why he has a scar here. You've noticed the scar probably. Okay, so that would be part of integumentary, which I can measure, but well healed. I mean, this is about 3 inches, 15 centimeters or so, right? This one was not, this was before your stroke.
Yes.
Yeah. How many years before? Quite a while.
Yeah, several.
Okay, so, but your calves aren't painful? There's no pain there? Okay.
Just no strength.
Okay. And we see hammer toes of all the rest of the toes, but these aren't quite as fixed. It gets progressively more fixed. And I'm seeing more bluing of this toe. Nail bed does profuse. You do have blood flows back into there. And I'm feeling a really good pedal pulse on both sides. These are a little more fixed than the other side, sir, aren't they? Except for baby finger, baby toe. And then we have this.
That's broken.
It's broken.
Was broken.
It was broken. As I go tapping on it. Okay, so we have the first metatarsal that's been broken. And you never got it set, or just decided to heal back that way, or?
Well, I was told originally it wasn't broken, but somebody else came in later and said, yeah, you got it broken there.
Too late now, right?
Yeah.
How do you think you did that? This was, I presume, before your stroke too, right? Before your
Yeah. I was bicycle riding then, and I had my young daughter in the seat in front of me, and another cyclist came out, very heavy little boy, came like this, and I said, it was just about dusk, and he didn't see me, and I stopped right just like that, and put my foot down like this, he ran over.
He ran over.
I was trying to keep her from, both of us from going
Sure, that's
down.
why you said he was a very heavy man. All right, well, you know what I'm gonna ask you to do next, right? Okay, you don't mind?
Where's my cane?
Okay, now notice
You
John's,
mean
notice
walking
John's
it.
cane, it says, it's like a sporting walking stick, okay? He likes this because it can telescope. Okay, just to one and back.
This is part of that.
That's good.
Better than my ears.
That's beautiful. That's all you need to do for right now. Tell me why you're shaking your head.
Yeah, that hurts.
Where does it
Hurts
hurt?
on the bottom of it.
Both feet or just your
Both.
left? Hurts on the bottom.
That was something I noticed a long time ago. There seemed to be less flesh underneath my feet. Anything I can say about that? It's always, for a long time bothered me to walk without some kind of footwear. Unless it was very thick hardwood.
And just touch the bottom of your foot. You guys just watch for a minute. Okay, so that's negative. Let's just see the bottom of this foot. Ugh, sorry. Okay. Quite a bit of pes planus, right? I mean, you're almost walking on the tips of these toes as a weight-bearing surface, aren't you? This is kind of in chronic extension. This is no real flexion. Does that hurt when I do that?
No. I do find myself on my heels a lot.
Okay, that was a positive Levinsky. I don't know if you guys saw it. It was kind of, excuse me, one more time. Okay, it's hard to see it because these toes are fixed, but he was extended. I didn't run over your toe, did I?
Can you do it again on the right?
The what?
The Norinsky, can you do it again on the right?
The right. Very, it's almost like it's a sensitive, it's a ticklish reaction more than anything else. There, that should be negative on the right.
Was the pain that he's receiving from his feet, was that before or after the stroke?
Ask John.
The pain that you were feeling on your feet, was that before the stroke or after the stroke?
Before, actually. It started.
You've
when I
always
was
been,
weight.
you've been tender before on the bottom of your foot. Okay, so now I'm gonna test your, do you wanna put your shoes and socks back on? Or are you okay?
Well, if they can stand it a little longer, I guess I can.
Here, because I wanna test your sensation. Tell me when you feel this. This is gonna be light touch. Actually, let's just go right to pinprick, okay? Tell me when you feel it. I'm gonna touch your forehead. That should be a prick, okay? Close your eyes. Tell me when you feel it.
Yes.
Does that feel the same as this?
No.
Which do you feel more?
And for it?
Okay. You feel that?
Yes.
What does it feel like?
Needle prick.
Okay. Does that feel the same as this? Pretty
Yes.
much.
Yes.
It's probably my technique, okay? Okay, you feel this?
Mhm.
Is that a prick or is it just pressure?
Pressure.
It's pressure. Prick or pressure? Prick?
Prick.
Is that about the same as this?
Say it's still a prick.
Still a prick? Does it feel the same between here and here?
That is,
Which one do you feel more? Your thumb or your forehead?
well, forehead then.
Okay. Point to where I'm touching you. Okay.
Left side.
Okay, point to where I just touched you. Does this feel the same as this?
It's lighter on my arm.
Does this feel the same as this?
Still lighter.
Does this feel the same as this?
No. It's stronger on my forehead.
Where'd I touch you? Where'd I touch you just now? Where'd I touch you now?
Perhaps there. Not sure.
Does this feel the same as this?
No.
Alright, so we're getting decreasing as I go. I could keep going, but I'm pressing pretty hard, so I don't think I'll draw blood with a toothpick. Are you okay?
Yeah.
Alright. So he's decreased in sensation. Can you describe the feeling in your left arm to us? Can you guys see?
Most commonly it feels like it's sort of like it's encased in cement and I'm trying to move something that's a solid unit. If I try to straighten my arm out, I'm trying to break through something.
So like it's encased in cement, like it's difficult to move. So that's why the finger to nose test is important, because he has to switch actively between one muscle group and the other muscle group. So what about sensory wise? What does this arm feel like to you? Feeling, what do you feel in the arm? Is it like this one? Does it feel like this one?
No,
How does it
that.
feel differently? Is it hypersensitive?
Sometimes it is. It's kind of another matter though. bleed that I had.
Where was your bleed? What did they tell you? Where was it located?
Well, it's called a thalamic,
In the thalamus.
Thalamus.
So his bleed was in the thalamus. That's pretty specific. Okay, describe your feeling in this leg to us.
It's virtually the same feeling.
Do you have normal feeling in that left leg?
No.
No? What does it feel like?
Numbness.
Numbness. Okay,
That's
let's,
no true throughout. It's
let's,
sort of like sort of paralyzing numbness.
a paralyzing numbness.
Yeah, that's another way I sometimes think of it. It's that I'm actually paralyzed in a way. It's not feels numb.
Because it's difficult to move it, but also you don't feel it the same. Let's compare the two sides, okay? Okay, close your eyes. Tell me if you feel this.
Yeah.
Does that feel like a prick or does that feel sharp or does that feel dull?
Sharp.
Does,
Sharp.
okay, does this feel the same as this? Let me do
Not
that.
exactly.
Let me do that again. Does this feel the same as this?
Yes. The latter would be.
Okay. Does this feel the same as this?
Well, it feels similar, but it doesn't feel like the pressure was as much.
Let's
On
do
the
this,
left side.
let's do, on the left a little less, let's do this a different way. Does this feel the same as your forehead?
Yes.
Does this feel the same as your forehead?
Yes.
Does this feel the same as your forehead?
They're both sharp, yes.
Does this feel the same as your forehead?
Yeah.
This feel the same as your forehead?
Yes.
And does this feel the same as your forehead?
Yes.
Okay, so it feels prickly, sharp on that side, on this side?
Yeah, I can feel the sharpness.
Yeah. Does it feel as sharp as your forehead?
Not as sharp. No.
Okay.
I'm
So
thinking
did,
more in terms of the quality of the point.
yeah,
Yeah. I can still,
okay, we got it, we're
it's
gonna,
not, it's not like soft and sharp, it seems like sharp all the time.
sharp all the
More
time,
pressure sometimes.
but more pressure. Okay, you see why I can't compare this side
More
to this
pressure
side? I
here.
have to go back to my reference. Okay. Tell me when you feel me touching you. Close your eyes. Where'd I touch you? Okay. Take one finger and point to where I touched you. Does this feel the same as this?
Yes.
Does this feel the same as this?
Strong.
Which one do you feel more?
One,
So just about isn't exactly the same. Does that make sense? All right. Does this feel the same as this? Does this feel the same as this?
Not the same.
About the same? Which one do you feel more? Foot? Does this feel the same as this?
I didn't feel anything lower. I felt that you went that direction. but I didn't feel it.
Does this feel the same as this?
No, this was heavy.
Where did I just touch you?
Foot,
The
toes.
foot, but it felt more dull or lesser than the forehead?
Yes.
So we're seeing kind of a similar pattern and the leg distally lesser than proximal. Everybody okay with that? Is there anything else you guys want me to do on that? You okay with that? Okay, I'm gonna move this arm into different positions. I want you to copy it with that arm. Close your eyes. He's really stiff, he's stiffened up this arm, so I can't even move it. Okay. All right, that's a quick way to test arm. But I'm feeling what you have going on here is you have a lot of stiffness in that shoulder, don't you? Okay, let's try it a different way. This is up, this is down. This is up, this is down at your wrist. Close your eyes and tell me if I'm moving you up or down. Up or down?
It's neutral.
Am I moving towards up or towards down?
It's not
Towards up or towards down?
up.
Relax. Towards up or towards down? Relax. Towards up or towards down?
Down.
Towards up or towards down?
Down.
Towards up or towards down?
Up.
Alright, so it's, are you guessing?
Yeah.
Because you did pretty well copying, what he was doing was mirroring, right? You did pretty well mirroring. But then it started like, maybe up, maybe down, and we're getting a little bit of, you have a little bit of, problems in your wrist stability here. Can you feel that? You have some popping going on in this wrist, so you might be getting other messages there, because every time I would get you in a position, you were like stiff right there. Does that make sense? That's just for kicks, since we've gone this far on this. Hold just these fingers. This is up, this is down. Close your eyes. Up or down? Up or down? Moving towards up or down?
Feeling change.
Moving towards up or down? Remove the distal tip of your thumb. Up or down? Up or down?
No change.
Okay. So I could keep going, but I think as we go more distally, more and more, less and less actually, ability to detect where I am. Okay, let's just try your elbow for kicks, right? Okay, this is up, this is down. This is up, this is down. Okay, close your eyes. Up or down? Up or down?
Up.
Up or down? Up or down? Up or down?
Up.
So you feel more in your elbow? Were your eyes open?
No. Yeah, I guess, right.
You did guess right. So tell us more
Felt
about,
more there.
you felt more there, okay. So one of the things, you can see some posturing of John's hand. Can you see kind of the posturing that he's going into? Did you notice that? Okay. Okay, squeeze my wrist hard. Hard as you can. You can do it. Hold on any way you want. Come on, you can do it, you can do it, you can do it. Okay. This side. Come on, squeeze hard, squeeze hard, squeeze it. Man, your grip is actually harder on that side than this side. That's pretty good. For kicks, let's see your muscle action here. Your reflexes. Okay. excessive, it's pretty much normal. A little more exaggerated on this side. A little carry over into the upper part.
So I've often wondered what you're looking for. There doesn't seem to be any movement between.
Well, we're looking to see if the muscles come in, and you're a little more hyper reflexive on